Low back is a common thing we treat in our office. I'm Dr. Kevin Christie, and we're going to go over today the sacrum and how that plays a role in it. A lot of times with low back pain, we'll see someone that's hyperlordotic or hypolordotic, or they have a high arch or they have a flat back. Okay? And that sacrum plays a key role in that. One of the adjustments we do is to determine, do you need some extension in there, or what we would call nutation, or do you need some flexion in there, or we would call sacral counternutation? And we do a specific adjustment to do that. Depending on what you need, we would contact either the top or the bottom part of the sacrum. Instead of getting a lot of rotation in the pelvis on this adjustment, it's more of extension or flexion. It's kind of motion like that, A to P motion into the sacrum. Go ahead and stand up for me. And so what we'll check here is a lot of times while the patient has a really deep arch, that's going to give us a little bit of a clue, or they have a real flat back, and that's also going to give us a little bit of a clue. We would then go in and do palpation to see, is that sacrum not moving well like it should that way, or is it not moving the opposite way? So I'm going to show you one adjustment. I'm going to assume that based on a palpation, he needs to get a little more extension in there. And so Brian, I'm going to have you come with me. Go ahead on your side, facing this way, head right there. So you've seen a lot of times with the side posture adjustment of chiropractors, we're going to get into there. Good. And then when I have him in that where I need to get the sacrum to go forward a little bit or more anterior, I'm going to have the leg down just a little bit there, like that. We're going to get on the top part of the sacrum, and we're in here, right there, and then it's going to be just a nice pop, just like that. All right. We would get a little bit more on there depending on what's needed. That's going to help get some motion in that sacrum and help with some of the low back pain that you're having. In addition to that, we would be doing some muscle work, some corrective exercises, and some other modalities that you may need to get out of back pain. But a lot of times that sacrum is a key issue of what's going on in the biomechanics of your whole lumbopelvic region, low back into the pelvis. That sacrum plays a big role in that.